Good afternoon, the staff. Uh, to start, my name is Jandudin. To start, let me start giving you a brief explanation of what electronic health record is. According to the Center for Medicaid and Medicare Service, electronic health record is electronic version of patient medical history that is maintained by provider over time and may include all key administrative, clinical data relevant to that person, care, and a particular provider, including demographics, progress note, problems, medication, vital sign, past medical history, immunization, laboratory tests, laboratory data, and radiology reports. This clearly shows that the main purpose of electronic health records is to improve healthcare delivery and its information use, and its information are used by researchers to improve healthcare delivery quality. As an overview, the United States is mandating healthcare organizations to shift from using papers to using electronic health records. So now you've understood what the electronic health record is. So let us explore its key components. You have understood what electronic health record is. So let us explore the key components. Key components of electronic health record that support directly clinical care and associated benefits and their issues. First, we have clinical components. Clinical components of electronic health records include electronic medical documentation, pharmacy system, nursing components, and computerized provider order entry. Computerized provider order entry, or named CPOE, allow providers to enter order links to patient data management. It is very useful for decision support. For instance, it can suggest the medicine that a patient may be allergic to, or medicine to diagnose a disease. Electronic medical documentation allows providers to track the history of patients' health information. For instance, it enables them to see past treatment notes and discharge and discharge summaries. Providers can access tools to use such as speech recognition, templates, and transcription services. Pharmacy systems allow to fill prescriptions and keep drug data helpful to the patient. The nursing component allows the collection of key patient information. It allows medical staff to have patient charts and nursing documentation. The benefits of this critical component in general are making service quick in timely manner, with which reduce patients' time waiting time, reducing medical errors since the information are entered at once, so easing the work of providers also. Issues that are associated with the clinical components are the following. Once it is breached, it can expose patients' information, which can endanger their privacy, or which can not be good to keep the patient's privacy. The patient's unwillingness or reluctance to have their information recorded in their electronic health record is also another issue. So second, let's look on the second components. Second component, we look at laboratory components. Laboratory component of electronic health record is a component that capture results from lab machine to the physician directly to integrate with others. The first benefit of it is that it is integrated with the billing of the patient in a way that some information is sent to the financial staff to deal with the patient's the payment of the patients, including the lab tests. The second benefit is that it supports direct clinical care by automatically sending easy information from the lab machine to the screen of the physicians to easier their orders. The third crucial benefit is that laboratory component makes it easier to know what medical exam providers need to perform uh, for a particular patient. The fourth benefit is that it automates services uh, to be performed by providers, which saves their time. For example, the system may send the result to providers without any need of any person in the lab to travel. Some issues associated with this component can be that it demands the highest level of technology, which may be very hard for providers to adapt to it, and internet issues that also may rise sometimes. In addition, the interpretation of results may be difficult because of the new language used in the electronic health record. This information was retrieved from practice partners in 2007. Second, let's now look on the component of electronic health record that supports administrative process and its associated benefits as well as issues. So, patient management components. The patient management component is a component that is highly needed for patients registration, admission, discharge, and transfers. In the registration, patients' information is recorded to identify them individually. This may include health insurance and the ID of the patient and so on. Its two important benefits are supporting administrative process to measure its progress with its number of visits and how many patients are registered, helping the administration to sort the service very quickly by identifying patients easily is also another benefit. Issues with the patient management component may arise when the information registered is not correct. This may result to many medical errors since the practice is done based on the information that was registered before. For example, a patient may get the wrong medicine just because of the initial information that was not correct. All information can be retrieved from patient practice partners 2007 article. The second component in administrative, we see billing system. Billing system, according to the practice partners, the billing system can be described as a system that allows to first capture all costs of the patient throughout all care received in summary. To quickly, the second, to quickly provide a report to insurance companies to evaluate performance of healthcare organization to it so that it can according to the practice partner, the billing system can be described as a system that allows to capture all costs of the patient through all care received in summary to quickly provide a report to insurance companies to evaluate the performance of healthcare organization so that we can set new goals. This billing system has benefits and its issues associated with it. The benefits are supporting the administrative to charge patients quickly, reducing the waiting time for patients spend while waiting to pay for their services, monitoring the progress and performance of the clinic through reports made using the billing records or data. In addition, the issues associated with this billing system are, according to the practice partners, the low productivity of the staff due to the fact that the billing system is unfamiliar to them, the higher adjustment time because the system is new, lack of trust from patients generally, especially on payment process and their privacy. So then now let's look on the importance of the integration of the administrative and clinical areas for effective use of an electronic health record. The role of administration is to ensure that providers have resources needed to do their work well. It has to ensure the resources are well used and managed. The electronic health record is used on not only to record patients' information, but also to track the use of resources. For example, it's easier to track what equipment were used during some treatment of patients. Clearly, the importance of administrative area for effective use of electronic health record is that this area help the administration to track revenues and expense. In addition, it enables healthcare organizations to provide clear reports to insurance companies in a quick way. For instance, the administration area gives patients an opportunity to the care they need, to access the care they need. On the other hand, the importance of clinical area is that it reduces the time that patients wait for services. Besides reducing time, it quickens the flow of information between providers and patients, which accelerates and eases the access of healthcare services. Providers access tools that can help them to provide better care to patients. For example, with electronic health records, they have access to support. They have access to support in decision making. There are so many resources of information available to providers that they can easily recommend to their patients to improve their awareness. Sharing of information also benefit providers from using accurate information of patients. As a result, it reduces medical errors and increases efficiency of healthcare delivery. Our information can get more information from the practice partners. Thank you so much. I was happy to preview